Welcome everyone to this webinar on lives and livelihood, global mortality and poverty effects of COVID-19. I am Asad Islam, Director of the Center for Development Economics and Sustainability at Monash Business School. This webinar is hosted by the CDS. It's part of our ongoing series, COVID-19 and Beyond, to provide a forum for discussion on the huge economic and social ramification of the pandemic and the priorities for the evolving policy response in both developing and developed countries. COVID-19 has already threatened the lives and livelihoods of people globally. Following the outbreak, countries around the world took measures to lock down markets and restrict movements to prevent the spread of the virus. Although these measures are seen important in containing the diseases, they also cause a high cost, particularly to the poor and vulnerable people in developing countries, as it disrupts their employment, earnings, and purchasing power. We also need to think about saving lives and protecting the public health. As we speak now, in fact, there are almost 19 million cases and 700,000 people died due to this virus. While many countries are experiencing new outbreaks, like we are seeing in Melbourne, we are now in a lockdown, and many are also starting to relax their lockdown to restart their economy. But in the absence of effective vaccine, government must continue to protect their citizens from further infection. And government also needs to balance saving lives and protecting livelihoods. There are many key issues affecting this balance, and those should inform the government's lockdown strategy. We also see the global economic outlook is very uncertain. According to the recent World Bank estimates, the global economy will shrink by 5.2% in 2020. So this is the deepest global recession in decades. Per capita income is also projected to decline in both emerging and developing countries. These countries also rely a lot on remittances. According to the recent estimates, that remittance will fall down by almost 110 billion, and half of them will be in Asia and Pacific region. We have also heard from our speakers, from the first speaker, Martin Rebellion, that world poor people cannot be protected from coronavirus because they do not have simple means how to protect them. As we see over time, there has been many issues in terms of protecting these people. Food security has become a very important issue in poor countries and developing countries, and especially many people who are low income or middle income people have turned out to be food insecure. And it is estimated that more than 250 million people could face starvation during this pandemic, which is largely due to this lockdown and other issues that are needed to protect the people's lives. So we need to think about mortality, morbidity, as well as poverty to understand the welfare effects of this pandemic. We will hear from today's presentation and from our speaker who will provide scenarios and estimates in terms of the life lost and additional poverty years that are due to COVID-19. Our speaker today is Professor Francisco Ferreira from London School of Economics. Professor Ferreira is now the Amartya Sen Professor of Inequality Studies and Director of the International Inequalities Institute at the LSE. He has a long and distinguished career at the World Bank, which included the roles in Development Research Group, as well as Chief Economist for the Africa region. He also served as the Deputy Chief Economist for Latin America and the Caribbean, and co-director of the World Development Report 2006 on equity and development. His recent work has focused on the definition and measurement of inequality of opportunity. His work has been published widely in leading journals. After his presentation, my colleague, CDS Deputy Director, Gaurav Datt, will offer comments as discussion on the presentation. Gaurav is also was also in World Bank before joining at Monash, and he has done a lot of work on poverty and inequality and income distribution. So today's, after a discussion, there will be a Q&A session from the audience. So please post your questions in the Q&A function of the Zoom during the proceedings, and I will pass those questions to our speaker. So with this, I will now invite Professor Ferreira to give his presentation.
Thank you very much, Asad. I hope you can hear me. Thank you, and thanks to Gaurav as well for the invitation to join you today. Let me try and share my screen here with you. Can you see the screen? Okay, great. I'll maximize this. So thanks again for the invitation. The paper I'm going to talk about today is called Lives and Livelihoods, much as per Asad's introduction. And it contains some estimates of the global effects of the COVID-19 pandemic, both in terms of mortality and poverty. And as I'll discuss in a moment, those are not exhaustive. Not all of the effects, positive or negative, mostly negative, of the pandemic are included, but we will try to cover mortality and poverty. And this is joint work with Benoit Desserf, Daniel Mahler, and Olivier Sterck. The outline is pretty standard. I'll motivate briefly with an introduction, provide a simple conceptual framework. So there'll just be 2 slides with some equations, which I think are useful, so that you see that what we're doing, although very descriptive, is grounded or can be grounded in standard welfare economics approach. And then the 2 main parts of the talk are these sections 3 and 4, the 2 empirical parts. In the first, I'll provide some estimates of mortality and poverty costs, so the welfare costs actually observed or estimated as of early June. First for 6 countries for which we have better data, and then more widely for 150 countries where we have to make some more assumptions, and I'll discuss those. And then in a second empirical section, we'll do estimates, provide some estimates of what might have happened under a no intervention scenario, that is, under some assumptions that might have generated herd immunity with no intervention of any kind. I'll briefly discuss limitations of the work, some limitations, and provide some conclusions at the end. So the introduction is, as I said, the paper tries to do 2 things. First, to provide some estimates of the aggregate welfare costs arising from these 2 channels: premature mortality, so the extra death that's caused by the pandemic, and the bigger increases in poverty. That is not exhaustive. There will be costs in terms of health that don't lead to mortality that will be ignored, and income costs or consumption costs that don't lead to higher poverty, which will also be ignored. So it is focusing really on these 2 channels. And furthermore, long-term effects on poverty arising, for example, from the schooling crisis and nutritional insults that are being caused by the pandemic now, but will affect children in the future, those are also excluded. So it's important to remember that these are estimates of these two channels, but they are limited in this way. Now, what we also try to do is shed some light on the relative magnitudes of these two effects. So on the relative importance of the poverty and mortality welfare costs across different settings, right? So the empirical challenge, of course, is that economic costs are typically measured in monetary units, in dollars or pesos or pounds, and mortality costs are typically measured in the number of lives lost. Asad just gave an example of that by referring to 700,000 lives lost, right? Now, economists are used to dealing with those two different units and with finding an exchange rate between them through various approaches, the most frequent of which is probably valuation of a statistical life, which goes back to Schelling in the 60s. There's a very nice survey in the early 90s in the Journal of Economic Literature by Viscusi. You know, these are basically, simplifying a little bit, they're predominantly based on estimates of wage differentials between people that are comparable, otherwise comparable, and jobs that are otherwise comparable. But these people are working in jobs that, whilst otherwise comparable, imply different risks of death. And given that they imply different risks of death, the differential compensation, the pay gap, might be interpreted as some valuation of the probability of dying, right? So that's the essential insight of these methods. But they do lead to very, very different estimates depending on the setting, depending on the jobs, depending on the estimates. There's also an approach which is a little more structural, based a little bit more on welfare economics, using expected lifetime utility models like Beckerson, Philipson, and Suarez, or Jones and Clino. And there are some estimates that avoid the discussion of the trade-off at all by focusing just on mortality causes, both caused by pandemic and caused by poverty, but those ignore, of course, any poverty costs that are not deaths. Okay, so our idea here is to bypass a little bit this problem of putting a price on a human life. Not that I personally have, or my co-authors, I don't think, have anything terribly against these methods. Some of them are very ingenious. They do lead to very wide ranges for the same settings, which is a problem. And also they have a problem in the public debate, because this reaction that I have here from the governor of New York State, Andrew Cuomo, in early May, when New York was in the middle of the crisis, is not atypical of how people respond, right? They say, how much is a human life worth? To me, a human life is priceless. So if the public and policymakers take that attitude, then these kinds of approaches are somewhat limited in their usefulness in the public debate. And we were hoping that perhaps our approach that bypasses that will be of some use. Related literature, very quickly, four groups of papers at least. I mean, there are more probably. The basic idea of using years of life and years in poverty as a comparison comes from this paper by my co-author Benoît Desserf with Jean-Marie Balin and Guillaume Cassin. There are other papers that have been trying to estimate the impacts of the pandemic on global poverty. There are 3 of them here. We are closest in approach to Lackner et al. One of the et al. Is Daniel Mahler, who's another co-author along with Benoit in this paper. We look at economic and mortality costs, and so do Hall, Jones, and Clino, and Bethune and Korinek. So they look at these kind of trade-offs between lives and livelihoods is actually in the title of this paper as well, or trading off consumption against deaths in this paper. They follow some of these approaches that I just mentioned, which are a little more traditional in terms of valuation of statistical life, or the more welfare economics-based approaches. And then there are some papers by Allon et al. And Olivier Barguin and a co-author that look at the differential impact of COVID and the differential policy responses in developing countries, which are also related to this paper. And I always pause when I'm in the slide, because I think it's the first time in my life where I present a paper where the related literature slide is all from the same year where I'm presenting the paper. So this is just a reflection of how the professions kind of become very focused on COVID, perhaps for understandable reasons. You've been having this whole seminar series on that, and you can see here a little bit of the literature, and there's much more, as you all know. So let me talk a little bit about our conceptual framework. Again, the point just being to anchor the empirics later, so that you see that they are actually compatible with a fairly standard utilitarian model of welfare with just a few tweaks. And so individual utility for individual I here, expected utility, is going to be the sum of instantaneous utility from year t to the year of the person's death, di. But instead of having a continuous income variable here, we're just going to simplify things a little by having a status that the utility is a function of. And the status can be, you can be poor or you can be non-poor. Or you can be dead. If you're dead, your utility is normalized to 0. But this ranking always holds. If you're poor, you're better off than you're dead. And if you're non-poor, you're better off than if you're poor. And that's your individual utility. And social welfare is just a Benthamite, unweighted aggregation of that. And note that we're also simplifying by doing away with discounting here. Now, the pandemic hits, and the way we model the pandemic, or model is a big word, but the way we represent it here is by this index prime. So people's utility changes from UI to UI prime because of the pandemic, and there are two things that can happen to people. One is that instead of dying a DI, they may die sooner. They may die now because they're sick. And in that case, for each year between now and their otherwise expected death, they will have a utility loss which is equal to delta UD. That's one source of cost. The other source of cost is that while they're alive, they may become poor. And if they become poor, which is what this indicator function does, it takes the value 1 if the status of the individual would have been non-poor, but with the pandemic it is poor. Then he or she loses delta UP of utility, which is just that gap between the utility of the non-poor and the poor. For the utility loss when you die, you could have different values if you were going to be poor or non-poor. That's what the model would suggest you're right. But we find that morally objectionable. And so we impose that if you're dead, your loss of utility is just the gap that you would have if you had been non-poor. So it's U of non-poor minus 0, which is just that, right? Now, oops, I didn't mean to do that yet. So that these changes, now you aggregate across these, and note, first of all, that delta UD is bigger than delta UP, right? Because delta UP is this gap and delta UD is this gap. So we can write delta UD as alpha of delta UP when alpha is just bigger than 1. Now delta UP is a constant here across individuals and time, so it can come out of here. And if it comes out of here, you're left with the sum of alpha for each year of life lost for each person. And when you add that across individuals, you get this quantity here. That's just the total of years of life lost to the pandemic. Yeah? And here you have additional years spent in poverty, which is, again, this is that indicator function between here and whilst the individuals are alive and across all individuals. And so if you write that as Ly and this is Py, you end up with this basic equation here that just says the change in welfare due to the pandemic is proportional, right, to a weighted sum of additional years spent in poverty and years of life lost to the pandemic, with this weight alpha, which is the normative weight. Of course, you can never get away from a trade-off from a sort of utility exchange rate, if you like, between these two quantities, years in poverty and life years. Alpha is bigger than 1, but other than that, we're going to be agnostic about it. How should you think of alpha? Well, we think of alpha perhaps as the answer that people would give. That would vary in the population, but perhaps the average answer that people would give to the question, how many years in your remaining life would you be willing to live in poverty if you otherwise weren't going to live in poverty? How many would you live in poverty in order to add 1 more year to your lifespan? So you're going to die at 74. now to die at 75, how much are you willing to live in poverty to get that extra year? That's one way of thinking of alpha. We are going to remain agnostic about alpha. Alpha is a normative parameter that we want the reader to think about and choose. Instead, we'll present an empirical break-even alpha. We'll present an empirical description, which is for each country by June, early June, we'll give you estimates of the additional years in poverty and the years of life lost. And you can think of that as a break-even. You can think of that as if your alpha was equal to that ratio, then you would say the two sources contributed equally to welfare, right? If your alpha was equal to that, then you would say this is equal to that, and so both sources contribute equally. So if your alpha happens to be higher than alpha hat, then you would say, no, mortality is more important. If your alpha is lower than alpha hat, you would say, well, actually, poverty is the bigger source of welfare costs there. Okay. So this is what all we do. We're going to present estimates of this in the first part of the paper. And how do we do that? So how do we estimate these things? Well, the life years are pretty straightforward if we happen to have information on age-specific mortality. So if we know the age at which each COVID-19 death took place, then we have from the population pyramids in the global burden of disease database, we can have the residual life expectancy at each age in each country. That is, in Australia, if you happen to have already reached the age of 72, what is your life expectancy? Well, whatever it is, 8 years or 10 years. If you die at 72, that's going to be your years of life lost. And we add across all those in the population, and you get an estimate of the total years of life lost, or life years, as we call them in this paper. Poverty is a little bit more involved, but what we do is we have the income distribution for a whole range of countries, 150 that I'll show you. From the PovCalNet database that Gaurav knows very well, and many of you may be familiar with at the World Bank. And then we shock that income distribution with a GDP decline, right? A recession shock. And how do we get that? We get that basically by subtracting the January forecast for growth in 2020 from the June forecast in 2020 from different sources. In one exercise is all going to be the global economics prospect. In another one, there'll be some national estimates. But the idea is in January, everybody thought COVID was just something that was happening in Wuhan and wasn't going to affect the rest of us. And in June, we all thought it's going to affect us massively, and here's the recession that it will cause. And so that difference actually netting a difference for 2019 forecasts, but that's a technicality. That's what we get. GDP growth is not the same as growth in household survey incomes. So we use a pass-through that Martin Ravalion and others have come up with, this 0.85 here uniformly across people. We assume the recession is distribution neutral. So we distribute that shock equiproportionately for everyone in the distribution as a baseline. We have one exercise based on some data for Argentina where we allow for some growth in inequality that I'll show you later. And importantly, we assume that this extra poverty lasts for just 1 year to calculate this PY, okay? And that's gonna provide kind of a lower bound for our PYA because it's quite possible they would last longer. This may be thought of as an upper bound or an upper estimate, at least, an upwardly biased estimate of lives lost, because we're taking away from people the average residual life expectancy at each age. You might say that people who are sicker or have underlying health conditions would have lived less otherwise. So in some case, in some ways, we're biasing this number down by biasing the numerator down and the denominator up. And that goes against us because, as you'll see, we actually end up showing that poverty is a very important determinant relative to life years, even with those assumptions. Okay. So first we look at 6 countries for which we actually have information on COVID mortality disaggregated by age. These are Belgium, Sweden, the UK, Pakistan, Peru, and the Philippines. We use GDP estimates and forecasts from the central banks for these developed countries. from the World Bank's global economics prospects for these three, and we use national poverty lines. We follow this method that I just described here, and here you get some results. So for those 6 countries, let me show how you read this by looking just at the UK. So the number of deaths in the UK would have been something like 49,000, about 10 years, life years lost per death, given their ages and their life expectancies. So the total life years lost in the UK by June would have been 490,000. Whereas the impact on poverty would have been 4 million, 4.3 million. So this number, PY, over that number, that product, which is LY, gives you your alpha hat, right? Remember, your alpha hat is poverty years over life years. So that's what you get down here. So, for Belgium, it's actually a relatively low number. You might well believe that people would say, look, I'm prepared to spend 4 years in poverty, or 5 or 6, in order to get an extra year of my life later. So then for Belgium, if you feel that way, mortality in Belgium is a greater source of welfare loss than poverty. And you might argue the same for Sweden and the UK. It's getting a bit high, 8 or 9. It's 13 in Peru, and then it's 195 and 175 in the Philippines and Pakistan, where it becomes a little bit difficult to say that mortality is really a dominant cause there. It's at least very hard to say that poverty is not a very important source of the costs of welfare in those countries, right? There is, as you can see, a bit of a gap between the richer countries and the poorer countries. And that is due primarily, it's not actually due to the poverty side so much, because I'm not here using a uniform poverty line, right? I'm using the country's own specific poverty lines. And yes, the density around the poverty line may vary a little, but on the whole, these are country-specific poverty lines. The main reason for alpha hat being so different is that COVID is very age selective. Mortality, COVID mortality, is highly concentrated amongst the old. And there are 2 things about developed countries. They A, have more elderly people, and they B, each of those people have a higher residual life expectancy. So COVID then takes out more life years in these countries where there are more old people, and each of them have a higher residual life expectancy. Now, is that a general slope, that tendency for developing countries to have a relatively more important source of welfare loss coming from poverty relative to mortality? So to answer that, we decided to look at more countries, 150 for which we have income distribution data from PovCalNet. We use, as I said, the growth estimates for 2020, June estimates minus January estimates, to shock these distributions. Our poverty lines now are not national poverty lines anymore. I'm going to show you results in 2 goes. First, I'm going to show you results for lines that are not country specific, but are at least income class specific. So one line for low income countries, which is our international poverty line. Another line for lower middle income countries. Another line for upper middle income countries, and another line for high income countries. And each of these happens to be the median poverty line in a database of national poverty lines that Jolliffe and Prids have produced. So you can think of this as a typical poverty line amongst lower middle income, upper middle income, and high income countries. These are dollars in PPP, right, in purchasing power parity terms, per person per day. And I'll also just show you using a constant line for everyone, which is this $1.90 per person per day. So that's on the poverty side. Now on the mortality side, we now have to do a little bit of work, make some assumptions, because we don't actually observe for all of these countries age-specific mortality, which is this thing that we needed here, the death rate at age A in country J. So since we don't observe that for every country, we have this little equation that says these are infection fatality rates. Okay, so this is probability of dying conditional on being infected. These are the number of people in each age group. So if I add all this up, I have a sort of average or total infection fatality rate for the population. And I have death rates. Now, what I'm missing is the infection rate, right? So the probability that you get infected times the probability that you die conditional on being infected is the probability that you die. And so observing this and this, I can back out an average infection rate in country J. And then I use that infection rate across the age groups with this infection fatality rate to calculate this. Now, I don't observe the infection fatality rate at age A for every country either. So we do what many people have been doing, which is to use data for China, which are in this paper by Verdi et al., these infection fatality rates for China, for our developing countries, and the infection fatality rates from France for the developed countries. So here there are some assumptions, right? We are actually imputing China and France's infection fatality rates to calculate these things. And we are assuming that infection rates are uniform across age. Not their death rate, obviously, because the fatality rate is not constant, emphatically not constant. It looks, like that. But the infection rate needn't be constant either, and we have to assume that given our information to get at these age-specific death rates. So we're almost getting at some results. Here's just that shock. So the shocks, the growth shocks, you can see here, that's 0, that's minus 10%. You got a whole bunch of countries. Here, I think the simple average in this graph is something like minus 8% or something, but very big recessions, as Asad said in the introduction. In some cases, huge, like in Belize or Zimbabwe, Peru, Zimbabwe, or the Maldives. So very big economic shocks. So take these shocks, shock down the income distribution, bring it down, calculate the poverty years, make those calculations to get our death rates, compute the life expectancy that is lost to get the live years, and we can present you the analogs to that last row here. Remember this alphas, this break-even alphas that I had, I can now present them to you for 150 countries in this graph. So what are these numbers? They are the number of years each country has added to poverty over the number of years that have been lost in estimates, right, by June 2020. Now notice that these two slopes, these two scales are in logs. So this is not just a slightly downward sloping curve. This is a massively downward sloping curve. Even though the poverty line is becoming greater as I move from gray to green to yellow to pink, and what you get is that for some of the richer countries and a few of the upper middle income countries, you've got alphas in a plausible range where you might say, yes, I'm prepared to spend 10 or even 20 years in poverty if you get me an extra year of life at the end. But for these other countries over here, most of the poorer countries in the world, we are at 100 years, 100 extra years in poverty for each year lost of life, not each life, each year of life lost, right? And so it's hard not to say that poverty is a very substantial cost component of the cost for these countries. Really for all of them, but primarily for the poorer countries. Right? Here is the same curve, but obviously if you don't let poverty lines rise, it becomes even more stark. And then obviously for almost all rich countries, if you have your poverty line for calculating poverty years at $1.90, which is what this is, then mortality is going to be the dominant source of welfare loss for a large range of countries over here. So that's our first set of results, and all it says is, shed some light on the poverty and the mortality costs in terms of years, but also on their relative magnitude, right, through these ratios. Okay, that's what the first part does. But of course, it includes countries at very different stages of the pandemic. It includes countries with hugely varying policy responses. It can't really tell apart whether the poverty and the mortality are coming from the pandemic or the responses, right? It's the crisis as a whole, the combination of the pandemic and the responses that are causing these things. We're not saying that the poverty costs are caused just by the lockdowns. They may be caused by individual and firm policy, private responses to the pandemic, right? There's some evidence suggesting in the US that this happens quite a lot. And so this cannot, what we've shown you so far, cannot shed any light on the sort of Trump question, is the cure worse than the disease, right? So this is not a policy evaluation paper, it's a descriptive paper with estimates, but we thought in the second section, we would try to shed some light on this by computing counterfactual scenarios for a case where there is no intervention. That is to say, a counterfactual in which instead of having infection rates as observed, instead of having these infection rates over here, as observed in each country, we're going to set these infection rates to a Banerjee et al. Estimate in a paper that they had of an 80% infection rate, which was at the time their estimate of what was needed to generate herd immunity. By now, I think people feel that this is too high, that herd immunity can be reached at a lower infection rate, so this would change our results, but that's what we used at the time, you know, just about 2 months ago. That's what everybody thought was going to be the case, or, you know, was needed for herd immunity. We actually have two counterfactual scenarios for no intervention. One has hospitals saturated and the other does not. We don't have time to get into that detail, so just ignore that. It's obviously things are going to be worse if hospitals are saturated. An important thing to say is what I'm going to present these results now is I'm going to say, look, these are the actual estimates that we had. Let me make some estimates now for this herd immunity case, and then I'm going to show you the alpha at which these are equal. So this is going to be, again, a ratio, but now it's going to be this ratio of poverty years and the actual thing to this difference, because I'm going to make this hyper-conservative assumption that poverty years in the no intervention case are 0. That is, you know, what I like to call the Bolsonaro assumption. That is the idea that if you had no intervention at all, there wouldn't have been any poverty cost, which is of course nonsense. But this again biases results against us. So we're going to end up showing that actually these costs of the no intervention scenario are very high. And what you have to remember is simply that they would have been even higher if I allowed for some poverty increases. So the results I'm going to show now are a different alpha, not alpha hat, but alpha tilde. And that is the threshold at which I say the costs of what we've seen in June, the welfare losses by June, the actual welfare losses by June, are the same as my counterfactual welfare losses under no intervention. Any alpha higher than that means that the no intervention scenario would actually have given greater welfare losses, so things would be worse, okay? How do I get there? Well, much the same equation that I had before, except that now, you know, I still use the age-specific infection fatality rates from China or France, depending whether you are a developing or developed country, and the same population pyramids. But now instead of the country's estimated or observed infection rate in June, I will just plug everything to 80%, and that's going to give us our death rate simulations for herd immunity, okay? There are two sources of national difference now that this isn't one. Well, one is this China versus France, but two important ones, the population pyramids, and then what I've already discussed earlier, right? The fact that the residual life expectancies at each age differ across countries. Just to emphasize that a little bit, look at this very simple table here for Japan and Zimbabwe. Just to show you the population pyramid, right? So the Zimbabwean population, much, much younger, right? So many more old people in Japan. 34% of the population in Japan is 60 or over, but only 5% in Zimbabwe. And then those people live longer in Japan than in Zimbabwe. And so when you have a same infection taking place, there's going to be a bigger cost in Japan than in Zimbabwe by a factor of 9 or 8 or something like that. So a very big impact because just of the mathematics of these demographics here of an older population that would live longer. So if I plot the years of life lost per person, this is my LY, but normalized by population, against GDP per capita, you see this pattern here. Emphasize, here's Japan, here's Zimbabwe. The green is for the saturation scenario, when everybody that needed an ICU dies, and the blue is without saturation. I said I wasn't going to describe that very much, but the important point here is this upward slope. Again, this is logarithmic. So, you know, basically the years of life lost much more important in richer countries because of the demographics of older populations and a higher residual life expectancy. So what's my alpha tilde? What's you know, the ratio of poverty years to this life years difference that says, at, you know, if I have an alpha higher than this, things are actually worse in the no intervention scenario. Well, it turns out that these numbers now for all of my 150 countries are almost all below 1, which was the theoretical lower bound for alpha, right? So that's saying, you know, any value that you place, any extra value that you place, if you just place, you know, even the same value on 1 year of life lost as 1 year spent in poverty, you would prefer the scenario in June with the policy responses to a counterfactual no intervention scenario in which things were allowed to go to herd immunity and mortality would have been much greater. And this is, of course, only more emphasized if you use $1.90 as a single poverty line, as opposed to my 4 different poverty lines that I had before. So the message here is, you know, again, in the vast majority of countries, herd immunity would have been a dominated strategy for any plausible value of alpha. Only very, very few countries where you might even start to argue. So this is by no means an evaluation of any policy, but it does say doing nothing at least under that scenario of herd immunity that we used, would have led to catastrophic loss of life and very great losses in welfare, even if I don't count poverty losses in that scenario. So I'm going to almost get to conclusions now. I just want to show you here some basic numbers. The reason you get these big results, the reason that herd immunity scenario, the no intervention scenario, looks so bad is that mortality, so these are years of life lost under no intervention, you know, basically almost 100 times larger than the years of life lost in the current scenario. Now remember, this is only until June. And of course, as we know, much has happened since June, so this would look worse now. But comparing June, which is where we were, to this scenario, you know, these life losses are just different orders of magnitude, which is why the additional poverty that you get in the actual scenario, in the June scenario, you know, there are a large number of years, but they're just not enough to offset those massive tolls in terms of years of life lost in the big scenario. So that's it. I just have 2 slides. So let me, I'm at time, if not past time. So just 1 minute per slide now, if I may, just to say some limitations. I'm sure you'll have thought of many limitations of this exercise. A few just to highlight that we're aware of. Of course, utility here is a very core step function of income, right? This is a price you pay to convert things into years, is that you have to have utility in poverty and in non-poverty more or less constant, and so that step function is there. But at least it's a bit symmetric on the health side. You know, we don't count income losses either entirely above or below the poverty line, but neither do we count any health costs unless they also lead to crossing a threshold, which is the mortality threshold, right? An important shortcoming, I think, is that our poverty years are a consequence of the whole crisis, the epidemic plus responses. But the life years are a consequence of COVID alone. We don't have data on excess mortality, on mortality from people who had heart attacks but couldn't get to hospitals, and so on. So that might have added something to that. As I said, we're excluding the costs of future poverty, right? And yeah, we're not evaluating a policy response at all here. We're not claiming to do that, right? So what can we conclude given these caveats? 3 things. As of June 2020, we can say that the poverty costs, the poverty effects of the pandemic are of paramount importance as a source of welfare losses in many, many countries. Indeed, in many or most poor countries, it is likely to be the dominant source, unless you have, some very, very high alpha parameters. Now, this does not mean that the cure is worse than the disease. First, because this is not the effect just of the policy response. It's also the economic effect of the pandemic. But also because when we do our counterfactual no intervention scenario, the welfare losses would have been gigantic, at least at that 80% rate. Okay. That said, there is this very steep GDP per capita gradient, right? The poverty costs relative to mortality costs, for the reasons that I discussed, are very different in rich and poor countries. So the optimal policy responses in Denmark and Malawi, or in Peru and Japan, are likely to be different. So I'll just leave it there. I look forward now to hearing Gaurav's comments. Thanks very much for your attention.
So thanks a lot, and thank you, Chico, for that very extended presentation covering a lot of ground in this paper. And when I read the paper, I mean, at one level it looked deceptively simple. I mean, I would say deceptively because actually the paper is actually, is quite a blend of complexity and trying to be transparent, and conceptual development, as well as sort of empirical kind of tractability, and all with an eye to policy sort of issues, underlying policy issues. So it's the kind of work that we've actually come to expect from you, Chico. So that's it's good to see that, and there's a lot of work underlying this paper. There's a lot of work underlying this paper. So again, thanks to you and your team for pulling it all together. So I'm just going to make a few comments. Hopefully they are useful and maybe a bit provocative, or maybe not. Let's see. Okay. So I'm basically going to make four comments, and they're going to touch on these four sort of topics, if you like, and I mean, these are just sort of labels for the topics, so the comments are a little bit broader than what these headings might suggest. So the first one, rather than going through speaking out each one of them right now, let me just go to the first one, which has to do with the issue of the stage of the progression of the virus. So, so the thing is, as Chico mentioned, and this is a necessity of the sort of data that is available at the time of doing any analysis, and will remain true for any analysis for some time to come, that is all anchored at a particular point in time. And in this case, all the estimates are anchored at June 2020. So the point there is that, so not only when we're looking at estimates across countries, it's not only that the countries are at different stages of development, they're also at different stages of the progression of the virus. So to illustrate, and that makes sort of what you can conclude a little bit more difficult from that exercise. And to illustrate, I mean, this is basically what I have in that table. If you can see that table, is basically estimates I pulled off for 4 countries of the 6 countries that Chico talked about from table 1 in the paper, which Chico also presented. It's for Sweden, Philippines, UK, and Pakistan. And essentially what it has is the 2 key elements of the building blocks of the analysis that Chico's presented, which has to do with lost years and poverty years, normalized per person. And basically you have those numbers, estimated numbers for these 4 countries. And the ratio of the 2 is really the ratio which one can work out varies quite a lot across countries. And in fact, Chico made the point, and it's a key point of the paper, that countries such as Philippines and Pakistan, this ratio of poverty years to lost life years is an order of magnitude higher than for countries such as Sweden and UK. So those, the ratios, something less than 10 in Sweden and UK compared to 170 or 190 for Pakistan and Philippines. So what I did was just to present it somewhat differently. If one were to plot the poverty years on the vertical axis and life years lost on the horizontal axis, I've just literally just those estimates that I showed you in the table from the paper, I've just plotted them, PY against LY. And as you can see, that Pakistan and Philippines really are around here. Sweden and UK are way up there. The key point is that the slope of these lines, Pakistan and UK, is much steeper than the slope for Sweden and UK, which is the key point of the paper, that the poverty cost is much higher relative to life years lost. But you also notice that, and this is where the stage of progression of the virus point is relevant in my view, is that these countries are really are at a much earlier stage of the progression of the virus. And as the virus proceeds, it is quite likely that these countries are going to move closer in the direction of Sweden and UK. And for the reason that, it's not clear that, that the poverty years are going to rise as proportionately rise more relative to life years lost as the virus progresses. There's going to be much more mortality, as we're already beginning to see in more recent estimates. India is an example as well in that regard. So it's not clear if you were to compare countries at the similar stage of progression of the virus, how different they would look. So that's sort of the key point. The other thing actually, which, what I have those lines that I've, the dotted lines here, assume an alpha of 10. And you can think of these as budget constraints or the welfare cost, total welfare cost. And you can see that, at the early stages of the progression of the virus, I mean, the total welfare cost, assuming an alpha of 10, is much lower. I mean, this dotted lines are much more below those for Sweden and UK. And of course, over time, they will move out. So that's sort of the first point, really. Let me get on to the second point I want to make, which is that has to do with the estimation of poverty cost, the poverty years, and lost life years. So one point I think I'll just mention, in fact, the one listed right at the end of the slide, Chico's already kind of acknowledged. I mean, ideally, we want to measure lost life years by excess mortality, not just by the COVID mortality or the deaths which are attributed to COVID in terms of the how the notified COVID deaths. But, of course, excess mortality numbers, of course, there are some estimates beginning to become available. I've seen some for UK, for instance, and over time they will become available. And that may, so in some ways Chico made the point that the methodology is underestimating in general excess mortality, but there's one reason why actually is overestimating excess mortality, but one reason why you could be underestimating excess mortality, underestimating the mortality or the lost years due to mortality is because the excess mortality calculations will give you much larger numbers. Going to the estimation of the poverty years, I mean, the paper notes that the poverty cost is underestimated for two reasons. One is the assumption that the additional poverty lasts for only 1 year, as Chico mentioned, and also the growth effects of poverty and distribution neutral assumption. Second one is relaxed in one of the exercises in the paper. So, but the point I wanted to make was the poverty cost could also be overestimated. And the reason for that is that the baseline scenario, in a way, assumes that there is no intervention that takes place to provide support to the poor, basically. Because all the estimates are driven by the difference in the growth rates, right? which are kind of then worked through the income distribution. So any transfers that are made to the poor, as is happening in many countries, and some countries better than others, so they are not actually factored in. So think of an extreme example. Supposing a country were to offer an income guarantee to the poor, or to income guarantee to everyone in light of COVID for a period of time. So the poverty effect would be actually zero or even negative. Poverty cost would be zero or even negative. So, and that is then linked to the issue of, also it bleeds into the issue of how the fiscal response to the pandemic is financed and who bears the cost of that financing and so on. So there is a whole bunch of issues there, which I think one also needs to think about beyond the calculations that are presented in the paper. Third issue, which is, again, I guess it's an obvious one, that the exercise has the flavor of a decomposition exercise. I mean, one of the key motivations is really how much of the welfare cost is due to poverty and how much is due to increased mortality. And as is common with any decomposition exercises, really there is always a problem of attribution. Really, the issue of attribution is often is typically left unsettled by decomposition exercises. Something that I've been guilty of in some of the work I've done too. So, you know, but
Gaurav, if you can finish in 1 minute, yeah.
Yeah, I'll try to finish very quickly. So in particular, you know, what about the fear of pandemic mortality, which drives both individual behavior and government response, that leads to restriction of economic activity, which in turn leads to additional poverty. So the key point is that the poverty cost and mortality cost are not necessarily independent, and the issue of attribution of is left unsettled. Last point, actually, I mean, I probably don't have enough time to develop it, but letting it rip strategy, you know, the no intervention strategy involves this comparison of, you know, the actual cost and with the cost under no intervention or letting it rip, and what seems problematic is that again it's really that the actual cost is estimated as of June 2020. While the no intervention scenario is allowed to play out all the way till infection rate reaches 80%. But surely over that period, while the infection rate is going to the herd immunity level, the actual cost is not going to stay constant, going to be increasing quite, how rapidly we don't know, but it will definitely will increase. Also, one would also expect that the point that Chico also mentioned, that the poverty cost of non-intervention will also likely rise. You know, when you have 80% infection of the population infected, even with lower mortality rates, it's unlikely to, it's hard to believe that, you know, there wouldn't be any disruption in the economy, and the poverty cost would be zero in that. So the combined effect, they go in opposite directions on this key parameter alpha hat, which makes the welfare loss under no intervention equal to the actual welfare loss. It makes it difficult to predict really what will happen if you were to factor in these things. And so that's sort of the last point I want to make. So, you know, finally, I mean, you know, by the calculations that, you know, you've presented in the paper already, I mean, if you letting it rip, you know, can be expected to lead to as many as 40 million COVID deaths and 560 million lost years due to premature mortality. Do I need anything else to convince me that letting it rip is a dominated strategy? I mean, in some ways, those numbers are enough to convince me of that. So let me stop here. Thank you very much.
Chico, would you like to give any answer? I mean, not on the methodological point, but probably on the big picture of the points that he made.
Sure, just very briefly. These are excellent comments. It's the problem of having a reader like Gaurav is that he will spot all of the weaknesses, and I don't have any real issue with that. I mean, I was thinking, you know, and I the only thing I will say is that I think I kind of acknowledged those issues as I presented, and I think tried to do that in the paper as well. You know, his first point, Gaurav's first point about the stage of the virus progression is a really important one. And I was thinking, you know, could you do anything else? And of course you could simulate a model, right? You could use the SIR models There's this susceptible, exposed, infected, removed models that people have been using to calculate, to sort of make a simulation of what Pakistan and Philippines would be like when they had been as long in the pandemic as the UK and Sweden, as in the example that Gaurav used. You could do that. I think one reason we didn't do it was time, frankly, but the other reason we didn't do it was, look at the US now. No model would have predicted what happened to the US, right? Because it went in a sort of hump-shaped camel-back kind of curve that, initial models early on, ex ante, would not have simulated those at all. And I'm not sure that they would have simulated India or Peru either. I guess one way of saying what Gaurav's saying is that we're wrong, but at least we're transparently wrong. As in, you can easily understand what we've done, and perhaps what we should do, I don't know, is actually have a subsection where we say, these are the numbers as of June. If you impose some model, and there are many out there, you'd have to choose one and say, this is what they would look like if you try to bring them to the same stage. So I think that's something we could do, and I made a note of that. The point about the poverty estimates not accounting for social policy responses is an excellent one. And earlier today, I actually mentioned that Brazil, my own country, is one in which some of the preliminary estimates suggest that Gaurav's imagined scenario has actually happened. In Brazil, the first estimates suggest that poverty has gone down. So this really is a major issue for the paper, and a future version of it or a future paper might take into account when we actually have data on the social policy responses, which we didn't have when we wrote this, and that would be a much more nuanced picture. No comments on the other things. I mean, yeah, the problem of attribution is absolutely right, and again, I did say, and I think we're careful in the paper to say that whatever we estimate in the actual scenario, in the estimated June 2020 scenario, is the effect of the pandemic and the responses. And you don't decompose the poverty is due to the responses, not at all. There is evidence for the US and many other places that, in fact, in places where the containments, the lockdowns were lifted, activity recovered much less than people would expect because people are still afraid of the pandemic. So we know that's the case. And on the no intervention strategy, yes, I mean, I'm glad that you're convinced it's a dominated strategy. We are too. I'll leave it there in case there are some questions from the audience. But thanks very much, Gaurav. Those were excellent comments.
Thank you. I think we are over time, but we will have some one or two questions. So one question is related to this is how much we can generalize this in context say to understand the cost benefit analysis of any other kind of issues, like people are talking about hydrochlorine for COVID and other measures. That could you think about this method? How many years of life we can save or lost in terms of the policy responses?
Okay, I have no idea how we would incorporate hydroxychloroquine into this, because I have no idea what the effectiveness of that is. The evidence that I've read suggests not very much, but I will say that just in the broader spirit of the question, that some colleagues from Imperial College London have used our method in a paper arguing for, I forget what they're called, human trial vaccines or human challenge vaccines. So vaccine trials where you actually give a less tested vaccine to people with the risk that they get infected, but with the benefit that you get a test that's much faster. So basically a procedure which I don't understand very well that would accelerate vaccine tests. And they argue, look, these are the kinds of human costs in both life years and poverty years that would be saved if we accelerated the vaccine by 6 months. So, is it a fabulous method? I don't know, but I have actually seen it used to sort of suggest what kind of welfare benefits would be of an intervention that would contain the pandemic, like a vaccine.
So the other question is, in many countries, especially in developing countries, the mortality rate is underreported as perceived, and also the number of tests that are being done are very inadequately low. And given that your estimates are somehow based on this mortality, I think, so how we actually have, are we going to underestimate the life lost in these countries, and what your methods can address this?
The tests are less of an issue unless they are in China or France, because that's where the infection fatality rates come from. And actually in China and France, we have reason to believe that the testing was reasonably well reported, at least internally, so that we know what the infection fatality rates are reasonably well. To the extent that in other countries, the mortality itself, the deaths themselves are underreported. There's the issue of excess deaths that both Gaurav and I have mentioned, and that's, of course, ideally we would have that, and we don't. Now, if in addition COVID deaths themselves are underreported, then yes, we would be underestimating lives there. But I think there may be some underestimate of deaths, but by their very nature, they're somewhat harder to underreport than tests. So I think there may be some underestimate there, but I don't know that it would be huge.
So in other words, the estimates would be, higher for the developing country. Where
to the extent that there are some underreporting of deaths, but I doubt that point by itself would make these alpha hats that I had in the 100 or 1,000 change very much, frankly. That issue, I think, is a less important issue, given the magnitude of the observed numbers that we have.
Any insights in terms of the lockdown strategy that different countries have adopted, and how that actually could have impacted?
Well, so because of the problem of attribution that Gaurav highlighted, we are careful in the paper not to say that we are saying anything about any particular strategy, right? Because what we observe is the joint effect of policy responses and the pandemic and individual responses. So the only point we make is that clearly when you design a policy response in a poorer country, you have at least to be thinking about the poverty effects very much. So for example, suppose you were a large country with lots of migrant workers in your cities that would have nothing to do if you imposed a lockdown tomorrow, right? That may sound familiar to you, right? Then what you don't do is you don't impose a lockdown tomorrow with absolutely no regard for what happens to these people and where they might go and get some assistance. So if you are India, then it behooves you to think of the poor and the poverty design and the poverty response when you design the thing. I'm at a very high level of generality here, because I don't have specific evaluations of responses. But the point I'm trying to make about paying attention to the poverty impact in poor countries is don't import a lockdown. A lockdown strategy that works beautifully in Norway may not be the best thing for Malawi because the poverty consequences are different. Now, what that means in terms of how do you design it, that would be a much better paper that I haven't written. So.
The final question is in terms of the role of international community, particularly the World Bank and other agencies, in terms of reducing this human death and other factors. As a kind of a person from World Bank, you have spent decades. What do you think the role should be in this context, in particular in the context of developing countries case?
Well, you know, the early World Bank response, I was still there during the early phase of the pandemic, was largely focused on health, on getting poor countries loans to get respirators and to get personal protective equipment where places didn't have them at all. So there was an enormous amount of work that went into actually facilitating procurement of these basic goods for countries, which I think was important. I think another role that is important is our the World Bank social protection teams have kept track of the social protection responses. So the things that Gaurav was talking about, the income guarantees or the safety nets or the social transfers, the world actually knows what was done in lots and lots of countries, in part because of a team led by this guy, Ugo Gentilini at the World Bank, who's kept track of this. And by showing what one country is doing to another, I think there is an important role in sort of showing the examples and showing, look, you can actually make a difference in terms of the poverty reduction if you have a register, if you have a cadastre of where the poor are that you've built because you already had a pre-existing conditional cash transfer. Here's how you can use it. And no, don't have people stand up outside to collect checks like Peru did, because that, you know, conducive to contagion, try and do it through an electronic card or a deposit or something. So issues around the methods and principles of delivery of social services, which I think are also important, and it's something where the bank can play a role. And just one last point on that, the World Bank, but also other international organizations also have a role to play in countries where leaders want to ignore the science, in being one more voice in making sure that science and truth and evidence-based diagnoses are repeated and expressed. You know, like I'm thinking of Brazil, I'm thinking to some extent of Belarus, to some extent of the Philippines, and now that I don't work for the World Bank anymore, it's great I can actually name these countries, which I couldn't before. Okay, thank you.
Okay, thank you, Chico, and thank you, Gaurav, as well. So, and thank you to all of our audiences for joining us today. It was a great session. We learned a lot about poverty and mortality effects of COVID-19 so far. We hope some of us will take this forward in terms of understanding these issues in the current, using the current data more and taking it further. With this, we'd like to finish here, and thank you all. Stay well and stay safe.
Thank you. Bye-bye.
Bye for now. Yeah.